Good evening. Our top story tonight, with all the talk about cuts to Medicaid and Medicare in the big beautiful bill, we wanted to find out how much does your hospital depend on these programs to pay for services. Shabnam Dinesh investigated the numbers for 2 hospitals in Peoria and breaks them down. Shab.
Yeah, Thomas, I looked at the Illinois Hospital Report Card from the Illinois Department of Public Health, and it turns out Medicaid and Medicare make up huge pieces of the pie for our local hospitals.
OSF Healthcare, St. Francis Medical Center, and Carl Methodist Hospital are the 2 largest hospitals in the Peoria area. Chances are you've been to one or both for medical treatment. But with major cuts in Medicaid and Medicare in the reconciliation bill, I looked at how much the programs pay for inpatient and outpatient services using data from the Illinois Hospital Report Card. On average, Medicare and Medicaid combined pay for more than 70% of inpatient and outpatient services at each hospital. Breaking it down further, at OSF, Medicaid pays 23% and Medicare pays 49% of insurance for inpatient services. For outpatient services, 24% is covered by Medicaid and 36% by Medicare. Over at Carl Methodist, Medicaid pays 30% for inpatient services, while Medicare pays for 41%. For outpatient services, 27% covered by Medicaid, and Medicare covers 44%. Critics of the bill say the loss in revenue will force hospitals to cut services, jobs, or especially in rural areas, close altogether. But OSF seems cautiously optimistic, saying in a statement, in part, "At this time, it remains unclear how the changes will ultimately affect hospitals and how and when the provisions will be implemented." One area OSF and others will be keeping an eye on is the $50 billion for rural health care included in the bill. We remain hopeful that those who rely on us for care will not be negatively impacted and will continue to receive the high-quality, mission-driven care they deserve.
Now, if you're wondering who in Peoria County depends on these programs, take a look. 58,000 people in Peoria County rely on Medicaid. And then moving on to Medicare, 24,000 people in Peoria County rely on Medicare. That's according to the Illinois Department of Healthcare and Family Services. Now, while the stricter eligibility requirements for Medicaid kicked in on July 4th, there is more time for Medicare, the largest chunk of the pie. Structural cuts to Medicare won't start until 2027. Thomas.